Business English for medical purposes. Business English or EMP for doctors. The need for medical English has never been as pronounced as before, basically because English-speaking nations lead in research and development in medical fields. Professional development in medicine also depends upon the learners and professionals' knowledge of English. Also, the phenomena of immigration to English-speaking countries and the need to practice has led doctors to search for more and more EMP material. The aim of EMP for doctors is to improve the English skills of non-Anglophone health professionals. Most of the literature in EMP focuses on pedagogical research enterprise and on healthcare communication, especially between the communication between doctor and patient consultation. English is the international language of science and medicine, and this has led to fears that because of this predominance of English in the medical field, this would lead to a loss of specialist registers in the various national languages, and gradually English will dominate these languages. This would lead to inequality between people who are native speakers of English and non-native speakers and the non-native speakers of English in terms of their promotions, in terms of how many opportunities they have for publishing their work and practicing in those countries. However, research shows that this inequality is limited only to the spoken forms and not to writing or in publishing. The internationalization of education has led to more and more doctors traveling abroad to English-speaking countries and other countries using English in their conferences in order to publish, in order to attend symposia and other medical meetings. So this has led to a demand for EMP. Then in the EMP learners, a significant majority is of those who want to practice and they want to migrate to English-speaking countries. There are various types of courses which are offered for EMP, which vary according to duration, according to the audience, according to the medical specialty, which would be the topic, and in skills, genres, and in medical situations. The needs for EMP for doctors is for rapid reading. They would require the skills to read rapidly, long histories, conferences, published articles, and so on. Then for detailed study, writing themselves, writing histories and their research publications and so on, doing clinical work with English-speaking patients. They would need English for clinical work with English-speaking colleagues. They would need English for giving papers and reports, articles in English for publication and symposia, for corresponding with English-speaking colleagues on professional matters, understanding lectures, papers in English delivered orally at medical meetings and symposia, giving papers and lectures in English, participating in formal discussions at conferences, participating in postgraduate courses in English-speaking medical institutions, entertaining and being entertained, and so on. So EMP courses are a major need for medical practitioners, particularly for medical research, which is basically based upon doctor-patient communication skills for overseas doctors and also for overseas doctors who want to pass their registration exams in the English-speaking countries. Also, in situations where doctors have to take their histories in the local languages, but then have to translate those histories in order to present to their seniors and supervisors. So the needs and wants of doctors for EMP depend on what they perceive, the medical student perceives to be their need academically, and what the students perceive what he or she wants. So if the English is the language which they have to master, then teaching EMP should entail teaching them proficiency in language skills as well as grammar and vocabulary of English.